I received my undergraduate Bachelor of Science at University of California, San Diego. I went to medical school at the Chicago Medical School, and I did my training in urology at the University of Kansas Medical Center in Kansas City. Interestingly, when I was born, my mother was told by a spiritual advisor that your son is going to be a healer, which is really interesting. And she always encouraged me along that path. And I grew up in San Diego, and we actually made trips regularly down to the outskirts of Tijuana to orphanages where she was involved with a Catholic organization that brought physicians down to Mexico to provide care to the orphan children. We were able to do major cancer cases, but also a lot of endoscopic, smaller cases and that sort of thing. There were a lot of procedures in the office. You had long-term relationships with your patients, which is different from a lot of surgical specialties where you operate on them and then make sure they're better and then they sort of move on. In urology, we follow people for years and years and years. So all those things appeal to me. And I do a ton of treatment of urologic malignancies, so kidneys, ureter, bladder, prostate. I do a ton of stone disease treatment, both medical and surgical. I do a lot of benign prostate disease treatment. I've had the opportunity to be the first surgeon in all of St. Louis to do a procedure on the prostate called Aquablation using a robotically guided water jet to create a channel in the prostate which preserves sexual function and continence. I also have several other types of procedures I offer depending on the particulars of the patient's voiding symptoms, their prostate anatomy and the like. I also treat a lot of sexual dysfunction. I have studied martial arts for years. I have a black belt in Taekwondo. I have done some training in Krav Maga, which is Israeli hand-to-hand combat system, and I'm currently training in boxing. I also ride a Harley Davidson, and actually was recently at Bike Week down in Florida. I play guitar, and I played in a band for a couple of years, and we played out all the time. I think that everybody really should have a regular primary care physician to oversee their care, because the majority of the patients that we see come from referrals rather than direct consultations, although that does happen as well. And oftentimes there are treatments that the primary care physicians can initiate, and then in more complicated situations, the patients come see us for additional treatment options. A lot of it comes down to things that are good for general health, eating well, exercising, getting good sleep. And some urologic conditions, such as erectile dysfunction is a good example, can be a harbinger of other health conditions. So we as urologists try to work together with the primary care doctors a lot, say, hey, this gentleman who seems otherwise healthy is presenting with these sets of complaints. Maybe this warrants some additional follow-up. There is another area within urology in which there's been a significant amount of controversy, and that's with prostate cancer screening. And unfortunately, because of those controversies, there has been some loss of the benefits that we had gained with prostate cancer screening, namely in that death rates from prostate cancer decreased significantly with prostate cancer screening. And unfortunately, we're now seeing some patients have worse outcomes because they're not being screened because of some of the confusion. We do recommend that people have those conversations at least with their primary care physician about prostate cancer screening, because again, the sooner you capture it, the better the outcomes are. And oftentimes with the low-grade disease, we're going to be doing what's called active surveillance, which is monitoring that patient, but the patient is at least being monitored. And if things start to progress, then intervention can be undertaken at that point. So there's a real commitment to personal care here, which appealed to me. So it doesn't hurt that it's 5 minutes from my house.